If you're suffering with back pain for more than a few weeks and you want to get back exercising and training, then this video is perfect for you. Back pain can be very disruptive in your life. It can take your little bit of me time away from you. It can disable you from exercising and feeling like yourself. And weeks of that or months of that can make you feel a lot worse and affect other areas of your life. If you're suffering with back pain, generally misunderstood by the healthcare system, and there's a very much a find it and fix it approach. So you might be going to different healthcare professionals and trying to get something fixed or something is off or broken, and that's not it at all. And most people feel very vulnerable and are afraid to resume activities again out of fear of hurting themselves or making things worse. The reality is you need to start moving again before you feel ready to do so. And even though you might have a little bit of discomfort, the session we're going to go through here now is absolutely perfect and perfectly safe. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan, Dublin. Myself and Art are going to go through this session. At the end or afterwards, if you have any questions, feel free to comment below and we'll be happy to get back to you. So just before we go straight into the session, I have some other videos on back pain. You can see them here and here, where we talk about relaxed, loose movement. We're going to quickly go through 3 of these now with Aaron. So Aaron, if you want to start here. So these are gentle, relaxed exercises where you relax the muscles and you get some movement in. So these are important to do maybe after each set or throughout your session. As long as you're doing it and you're breathing and not holding your breath, and you're just allowing these muscles to relax. So you might just do 10 or 12 of these. Another option for you as well is if we just go into the rotation one there. So backs need to be able to rotate, and a lot of people move, generally if you have back pain, you move stiffer and slower for weeks and weeks or months afterwards. So trying to move freely and loosely is very important here, and it's fine if you feel a little bit of ache and discomfort. That generally is tense muscles, and muscles need to move. The third exercise that you can do to help here is to just, again, nice and relaxed and free, and allow your back to bend. Just ask yourself 2 questions as you do this: am I breathing and are my muscles relaxed? And try not to worry if you feel a little bit of something there. It's muscles that are bending and moving, and that's perfectly fine, normal. Fear holds people, that's an important concept. Let's go through the 4 exercises that you're going to start doing. So if you want to just jump up and bike, and again, the purpose of this is to get people moving again, and that's going to help your back pain. So keep the intensity. You know, you probably feel like you want to exercise a little bit more again, but you're not going to go crazy having not done anything for a while. So just start off, 50-60% effort, and let's say you'll do a minute or whatever it is on that, 30 seconds to 90 seconds depending on your fitness levels. Let's go straight from that over to rowing. Most people avoid these movements, but rowing is very good for your back. You can't really row without getting your muscles moving again. So as long as you're doing it nice and relaxed, it's a very good option for you. Good, so again, pick a time that you want to do there and just get it done nice and relaxed, moderate intensity. And let's into the 3rd station. And again, these are just options for you. You can pick other stations if you don't have access to this equipment. But again, we're going into the skier where you're just going nice and relaxed and moving and allowing your body to move. So again, pick a time that you want to do it at, 30 seconds to 90 seconds depending on your own confidence and conditioning levels. And then from that, the 4th and final station is ball slams here. So again, nice and relaxed. Pick up a light enough weight and just sit into it and start moving. And again, decide how many you want to do. You might do 10 to 20 repetitions. So there's your 4 exercises. After that, you might take a minute or 2, like Aaron there, to get your breath back and do some of those relaxed movements again. And remember, the purpose of this is to get moving again in order for your pain to go, rather than sitting at a desk, going to lots of healthcare professionals, paying loads of money, being told these 5 things are wrong with you, being told to stop doing this. All the time your pain is actually getting worse, you're certainly not improving. Your back needs to move. If you do this, it'll certainly give you some control back, it will improve your mood. There's some pain-killing effects from general exercise, and then as long as stress levels and sleep are starting to improve as well, you doing this for the first 2 to 3 weeks can make yourself feel a lot better without needing any other interventions from anyone else. I hope this makes sense. If you have any questions on this, like I said, please feel free to comment below and we'll be happy to help.